6, 5, 4, 3.
Good afternoon. I'm Steve Gracie with the Idaho Federation of Families for Children's Mental Health, and I want to welcome you to today's program. Today we're going to be talking about a film screening that's coming to Boise and the state of Idaho. It's actually already been here in Caldwell. It's a film called Resilience. Fortunately, we've been able to bring together the partnering organizations that are working with Optum Idaho to bring this particular film to the state. It's a follow-up or a prequel because it was filmed prior to Paper Tigers. I'm Steve Gracie with the Idaho Federation of Families for Children's Mental Health, and I want to welcome you to today's program.
Okay,
I'm about a film screening that's coming
How do you
to
turn the
Boise
sound
and the
up?
state of Idaho. It's actually already been here in Caldwell.
Sorry about that. We seem to have a little bit of a sound thing here going on.
Actually, what Carol just took away from the table here is the thing that's going to indicate, and something I need to tell you, is that there's a chat box. If you're watching this through our webinar series, or if you're watching it on channel 64, obviously you won't be able to do the chat box. But that's how we'll know when you're asking questions about what's going on. So this is Mental Health Awareness Week for children. Children's Mental Health Awareness Day is today, and that's a national celebration. The Federation itself has been utilizing these little beach balls that say, keep the ball rolling for children's mental health. So as part of Children's Mental Health Awareness Week and Children's Mental Health Awareness Day, we're having this particular conversation. So I'd like to welcome our guest right now. This is George Ann Benjamin from Optum Idaho. She's the executive director, and I'd like to say welcome to the program.
Thanks for having me.
And this is Shannon Decker, who's the executive director of the Speedy Foundation.
Thanks for having me.
And this is Roger Sherman, and he's the executive director of the Idaho Children's Trust Fund. So together, we've all partnered under the leadership of Optum Idaho to bring this particular film here. And as I said, it'll be shown in various locations. We'll talk a little bit about that as we move along. So I want to just start off with each person telling us a little bit about their organization. I'm going to go to George Ann. Can you tell us a little bit about Optum?
Sure. Thanks, Steve. So Optum is an integrated healthcare company that really our focus is on innovative services and programs to improve quality and improve outcomes of the members that we serve. In particular, in Idaho, we work directly with Department of Health and Welfare and the Medicaid division in administering and managing the Idaho Behavioral Health Plan and helping those members that we serve in their recovery journey.
Okay. And Resilience, the film itself, is part of an In Touch community conversations program?
Yeah, so the In Touch Community Conversations is something that we began last year, and education and information for Optum is really a constant for us. So the more we educate, the more we inform community members, providers, healthcare leaders, stakeholders. The more we are able to develop and keep our system growing and moving forward. So the In Touch Community Conversations, which Resilience is the topic for this upcoming next week, is, like I said, about educating and informing on different topics and different ideas to help people improve their health and the quality of care that they're receiving.
Okay. I think it's a really neat program that you're doing, and that's,
Thank you.
That's neat. Shannon, can you tell us a little bit about the Speedy Foundation?
Absolutely. Speedy Foundation was founded in 2011 in memory of Jarrett Speedy Peterson, who was an Olympic skier who died by suicide. And when he died, we learned that Idaho was the only state in the U.S. that didn't have a suicide prevention hotline. And so that became one of our first missions, was to champion that cause and to fundraise to get that relaunched. Now we work in suicide prevention and mental health advocacy. The conversation of ACEs is something that Speedy brought up when he spoke in the media. He tried to share experiences that he had in his childhood, and I think that if it was a conversation that he'd been able to have and that there wasn't as much stigma surrounding it, that things could have been different. And so we're out to try to normalize that conversation.
Shannon, you're also, the Speedy Foundation is also working with this particular region, the Boise area, on mental health first aid?
Absolutely, yeah. Mental health first aid is a program that we've found to be very impactful. It's an 8-hour class that we're going to be working with the Regional Behavioral Health Board to take into various school districts. And so tomorrow I've got a training, a youth mental health first aid training up in Garden Valley, Idaho, and we've got others scheduled throughout the summer. But there's a lot of different areas that are coming together and providing mental health first aid. We first partnered with Optum a couple years back in providing those trainings, and we provided those all over the state.
Yeah,
So,
it's really great to see them growing, and
Yeah.
and the youth focus is so important.
Yeah, exactly. Roger, not to leave you out of this conversation, but bring you
fine.
into it. Tell us a little bit about the trust fund.
So the Children's Trust Fund was started in the mid-'80s to focus on prevention of child abuse and neglect. And we've been working towards that end. Our real focus is around preventing child abuse and neglect before it occurs. So we look at it as something where we create the kinds of environments where kids can grow up and thrive without having abuse as part of the equation. We became probably acquainted with the adverse childhood experiences and the work of some of the discussion that's going on in this film, the ACEs discussion, probably 10 years ago, and have been working to make sure that more people know about it, how it impacts kids, and the impact of trauma on both our families and our communities.
Okay. And we're going to talk a little bit about exactly what you're talking about ACEs and how that came about, how it ties together with strengthening families and that movement and that you're involved. But you also brought these with you. What's this about, Raj? Besides,
So this is the this is the symbol of child abuse prevention, because what it focuses on is our aspiration. Really, what we want for all kids is to have a healthy, happy, carefree childhood. And so instead of focusing on what we want to change or fix, we focus on what we hope that we can achieve by working together to create an environment, again, where in communities where all kids can thrive.
Okay. Very good. I'll put that back there. Are those still available? Can you still get those from you? Or?
They are. We just have finished with Child Abuse Prevention Month, so we have fewer of them, but you've probably, hopefully you've seen them around the city and hopefully around the state.
I'm sure everybody's like out there going, I need one of those. That's
Who doesn't?
Wind power.
Who doesn't?
Okay, so this kind of thing. Last year we brought Paper Tigers to the state.
Yes.
And showed that film. Optum was the lead again on that.
Yeah.
And now we're doing resilience. Why is Optum so interested in doing resilience and following up with Paper Tigers?
Well, like I said, we are really focused on education and information. And Paper Tigers was, a documentary about a high school in Washington State that they followed the lives of teens that were, struggling in, school and in life, and it all backs up to the trauma that they experienced when they were younger. So resilience is really, a companion to the Paper Tigers documentary, and it really focuses on the science behind trauma. We have known for ever, it seems, that what happens when you're a child, can impact you, and resilience really draws out, why that is, and begins a conversation that your brain does not forget. You might not remember if something happened to you as an infant, but your brain remembers, and it has a lifelong effect. So resilience is really a demonstrating that and talking about the science behind childhood trauma, and the more people know about it,
Makes sense.
the better off we all are.
Yeah. And resilience is actually what's called a prequel, because it was actually filmed first before Paper Tigers.
True, right.
And then we put the Paper Tigers came out first. I guess the director
Yeah.
decided that made more sense to do it that way.
Yeah, and then resilience, like I said, is really the science behind the trauma, which, is so critically important in order to take action and move the system forward. So
Okay.
that's why, we feel it's important. We've had a great demand across the state for the viewing of it. It's so great to be able to work with Shannon and Roger and Federation of Families, in bringing this, to the communities.
Okay. And we're going to talk a little bit about the dates and where these are going to be showing, and as we have this conversation. But resilience, the idea of resiliency, that seems to be like the buzzword in mental health and stuff. And what does that mean, Shannon? What does it mean to you when you think of the word resiliency and how it connects to this?
Sure. Now, I don't really think of it as a buzzword, but I think of it as a kind of a paradigm shift. Resiliency, in my understanding and in my promotion of it, is the positive psychology mentality. And so with a lot of schools and school districts, they're working on teaching children strategies. There's, I think, 24 positive psychology strategies, such as gratitude, where if you can teach gratitude, you can change, somebody's outlook. So you need to acknowledge some of the trauma that's taken place and own it, and then move past it through positive means, restructuring the way the brain thinks to have a more positive outlook. And to me, that's resiliency, and that's in all the research and the work that we've done, the direction that we're headed. So it's more than just a buzzword. Mm-hmm. It's definitely kind of a reframing the way that we think.
It is. And Roger, when you're working with strengthening families, does resilience come into play with that idea?
So our work is focused around strengthening something we call strengthening families, which is based in 5 protective factors. The number one is resilience. And, at first we say that it's about parental resilience. It's about the ability of parents to deal with the things that are coming at them and the things that happen when you have a child and how that changes your life. And then later we think of it as something that you build your own resiliency as you grow older. So as a adolescent, you start to become more engaged in building your own resiliency. And it comes from many of the things that Shannon talked about, growing your own capacity to deal with adversity, to deal with situations that come at you. We say it's both a process and an outcome, that it's focused both on how do you deal with the adverse experiences that come at you, but also, in the long run, how do you learn from that? And so it's about growth and change.
Okay. So adverse childhood experience, that's ACE. And I guess that's the ACE's idea. That's what I think Paper Tigers, the film, kind of addressed as it progressed. This particular film is about how ACEs came about. What do you know about ACEs?
Well, like I said, the resilience film is really about the science behind childhood trauma and your ACE score, if you will. And so
ACE score?
Yeah, ACE. So the different childhood experiences, and if you have had one or more of them, then you get this score, and the higher your score is, then that equates to significant trauma that needs to be dealt with.
And so, is that your interpretation of what ACEs is as well? Does that sound right?
Well, there's something that are very common. I mean, we know. I just received some numbers out of Salmon, Idaho. Is that 25% of the kids in between 6th and 12th grade, were affected some way or another by adverse experiences, and this comes in 3 buckets. I mean, one is abuse, the other is neglect, and the other is family dysfunction. And family dysfunction being things like, divorce, domestic violence, other things that children witness and see the effects of.
So the trauma of early childhood experiences, that's sort of part of this idea. What about older people dealing with this? Can I take an ACEs test and get an idea of where I am?
Yeah,
Shan?
Absolutely. So to go off of what Georgianne was speaking about, the ACE test to get your ACE score is based off of a study out of Kaiser Permanente. And so it was based on questions that pediatricians were asking, not pediatricians, I'm sorry, that practitioners were asking their patients about things that had happened in childhood out of those 3 buckets. So there was a set of 10 questions. And based off of that, the researchers were able to correlate that to diseases that come on later in life. So, Steve, yes, as an adult, you can take the test. You can take your 10 questions, find out what your ACE score is based off of the experiences that you had before age 18, and find out, just what that correlates to. It doesn't mean that you're locked into that path. It doesn't mean that you had 6 ACEs in childhood and thus, you're at risk for cancer and that's written in stone. It means that it's a predictive factor, and there's a lot that can change. So yes, Steve, and I encourage you to. There's also a resilience test that you can take, and you can find out what are those positive strengths that have been built up in you, you've practiced, and that you really lean on in life. So I would encourage you, after you take your ACE score, to then take your resiliency score, because it's not something to dwell on. It's not all negative.
Okay. Is it something you pass or fail? Because I'll have to take it pass or fail.
No pass or fail, no judging. There's no curve.
Okay, so it's just do the test. Okay.
Just take the test. You'll get a number, and that kind of helps indicate, what your ACE score is. If you go to our website at thespeedyfoundation.org/resilience, you can take both of those tests there. And there's also a primer for resilience. And it talks about what are adverse childhood experiences, what is this study, and how as a nation we're combating that. So to get more of a background and some of the research behind it, definitely go take a look at that short 4-minute video. It's a little bit more well-spoken than I think any of us are.
Yeah.
So.
Well, Rod, you mentioned getting some information about Idaho salmon, right?
Yeah.
So people out there that are listening to this particular program, they're going, ACEs. So where do you get ACEs? Where do you take the test? How do you get your kids into that? Who's doing it? Do you know?
So, like you asked, most of the people who take the tests are adults. It's actually fairly rare. I got that information just recently, and it was like, oh, that's interesting. And I think it's because educators are really interested in how it impacts the children that they're working with, and how they then can respond to their trauma in trauma-informed ways, like it happened in the Paper Tigers film, for those who have seen it. Because that Paper Tigers film sort of dealt with a school that has gone through getting some understanding and then learning the practices for how they can work with the children that they're involved with. The best information on ACEs is really in the Centers for Disease Control's website, which is probably cdc.gov, I'm pretty sure. But like Shannon said, a lot of the materials on other websites, like the Speedy Foundation website and other places. Idaho information is kind of spotty. There's some information that came from Child Trends that looked at from a variety of different sources, came up with things that approximated the ACEs, and they were able to say that Idaho is in the top 25 states the top 25% of states in the country for 3 or 4 different of those ACEs, which involve mostly family dysfunction.
And when you say 25%, you mean like we're in the upper level?
We're in the upper level of those. Yeah, we're in the top. Yeah, it's most prevalent in Idaho. I guess that's the right. Yeah, of those, like, what would that be? 12 states or so.
Okay.
In the top 12 states in the country in terms of divorces, living with someone with mental illness, and substance abuse.
Wow. Okay. I'm going to come back over to Georgianne.
Okay.
When we're talking about the involvement of the community in general, we're going to be doing this program on the 13th. I'll just announce that too.
Okay.
Again, the Boise program will be on the 13th of this month. Mm-hmm. It will be at Boise State, and it'll have the screening of the film to begin with.
Yes.
It'll be followed by a panel or workshops, and those are kind of geared around professional ideas.
Right.
And then there'll be a public showing of the film, screening of the film later on that day.
Correct.
So if we're doing all these things, and I'm just wondering, why is it that we would be asking people to come to that particular program and participate in workshops? What are the workshops?
So the workshops are professional development workshops. So everyone is invited to the resilience screening and the workshops afterwards. So we know that it's not just one sector of our community that can work with children and help them if they've had an adverse childhood experience. It takes all of us. So the idea of the workshops is bringing together interdisciplinary people from different aspects of our community to work together, to have the conversation, to have the dialogue, and to begin to talk about action steps and what can we do as a community to move the system forward. So educators, law enforcement, providers, healthcare leaders, community members, families, stakeholders, everyone's invited because it takes all of us working together.
Okay. So even though Paper Tigers was filmed in Walla Walla and at the school, and is the story of the kids in that school and how that school responded to their particular traumas in early life, is what we're talking about at these workshops something that is just about kids in schools?
Yeah, so we'll have 3 speakers that will be talking to the folks that attend. James Redford, who's the producer of the film Resilience, and he'll be talking about the ACE, assessment and the science and why he made this documentary and why it was important. We'll also have the principal from the school that was profiled in Paper Tigers. He will be here, and he'll be talking specifically about his experience and what that school system has done and is doing to help children. And then we'll also have one of our local Optum experts talking about recovering resiliency and just some actions that we can do at a local level.
Okay. And that's all. That's the main program is in Boise. That's kind of a big all-day event.
Correct.
On the 13th.
Yeah. And it's in 2 parts. So there's a screening in the morning, and then the professional workshops, and then in the evening is another screening with a panel of interdisciplinaries that will be talking about each of their perspectives.
Yeah. Okay, that'll be perfect. Just so we might as well do this at this moment. The other screenings for the film is going to be in Twin Falls on the 11th of May. It'll be in Fort Hall on the 17th of May, and in Lewiston on the 22nd of May. The exact locations of that you could actually find out by going to your Optum website and looking up that. You could find it
And
at Speedy Foundation.
Yeah.
Probably
find
find
it
it
on
on the
our
trust
website,
fund.
too.
You can find it on ours, the Federation as well. So,
Yeah.
so that information is out there if you want to participate in any of those other programs, and including the Boise program. I understand. Do you have to register for this, Shannon?
You do have to register, and the good news is registration is free. So please sign up. Space is often limited by the capacity of the theater, so register early and get your ticket. Refreshments are being served, and Paper Tigers was a wonderful conversation starter. So we're excited to bring resilience and continue this conversation, especially with people coming from out of state to share what else is taking place throughout the country.
Okay. So you saw the film,
I've seen the film many times.
and what's your assessment of the film? Let's have a movie review. What do you think?
Yeah, A+.
2 thumbs up.
I think it's a great film. I think that one of the drawbacks for Paper Tigers is that it's long. This is a shorter film, and so to give a little bit of history, the Resilience and Paper Tigers are both documentaries. I call them sister documentaries, but Resilience was in the Sundance Film Festival, and then it did a film festival circuit. And so we screened Paper Tigers last fall because it had been released, whereas Resilience was still touring the film circuit. It's a much more acclaimed film, and it's wonderful. My favorite part is hearing from Dr. Burke Harris and her work on ACEs in San Francisco and what she's learned. So I highly recommend it.
You seen Rod, have you seen it?
Yeah, I have seen it. Yeah,
Okay.
we did a screening at our conference. It was, and I had seen it actually at a national meeting. It's a great film. Yeah, I agree with you. I've seen Dr. Harris speak a couple of times, and she's just super. And she's got a TED Talk that you can go to that'll give you a little background on ACEs. It won't give you the whole story, so don't just go to the TED Talk. You still have to come to the film. But it's. I think it really backs up Paper Tigers. I loved Paper Tigers. I think it's a story, it tells a great, but I actually think the two together are so powerful. And so if you've seen Paper Tigers or if you haven't, maybe we'll do another screening of Paper Tigers, after people have seen Resilience, because I think it gives you an idea of how the science then leads to, practical stuff that you can do as a teacher. We've had a couple opportunities to provide trainings at some education conferences in the last while, and boy, there is just such interest among educators, I think, and I think it was part of that rolling out the Paper Tigers that Optum did, which was fantastic, and that gave a lot of people some new ideas, because it isn't, because I think a lot of times we don't know, why do kids act like this? Why do they act like this? Are they just jerks? And you say, no, it's not that kids are jerks. Kids have things that are going on.
Right, absolutely.
Yeah, and absolutely, as Roger said, they're very powerful together. You don't have to see both of them. We actually had our first screening of Resilience already at Valley View in Caldwell, and many of the people that attended that screening had not seen Paper Tigers. They were inclined to watch Paper Tigers after that, but it's still a very important and relevant conversation.
Yeah, the part of it.
Absolutely. And in both films, it talks about, one of the key messages is just not, the question, what's wrong with you, but changing that to what's happened to you.
Right.
Both films focus on that. And not to give all the secrets away, but another key takeaway from Paper Tigers and Resilience and even mental health first aid is that one caring adult can change a person's life. That's one of those key protective factors. And so,
Absolutely.
Yeah, and there is a screening of Paper Tigers that's going to take place tomorrow night or Saturday in Idaho Falls. I'm pretty sure. I think you guys are involved with that at Optum, but I don't have it in my notes. but I know it's taking place. So they're doing Paper Tigers and Resilience. Let's see, right?
Yeah, we are showing Paper Tigers at different venues across the state, as well as Resilience. So these are the main events that we've been talking about, but there's also smaller events in communities, which is really, it's so wonderful that it's happening, because that's really what we all wanted, is just to keep the momentum going, and for communities to take it upon themselves, to show the films and then have conversations about it.
Oh yeah, and so Paper Tigers is still out there and available for people to get. Is it something they get through you or Speedy or Trust Fund?
We have one.
We have I think all of us.
So, and it's easy to get.
Yeah.
So if you partner with an elementary school, a university, a nonprofit, the film is very inexpensive to purchase. And so there's information on our website about how to bring it to your community. It's something that, anyone can do.
Right.
Okay, so Paper Tigers, you can still get that.
Mm-hmm.
What about the Resilience film? What will happen after? Was that going to continue on? Is like Paper Tigers? Is it going to be available as well if people can't make these screenings and so on?
Yeah.
If you are interested in screening the film, putting together a screening, you do have to get the rights to the film, but reach out. There'll be information on the Speedy Foundation's website, or you can email us and we can point you in the right direction. I think Paper Tigers, it runs $75 for a public library and for an elementary school to purchase, and then screened there on site. Resilience, I believe, is around $95. But it's worth it. You can sell tickets to raise the funds for that. But it's really about a community putting the screening together, hosting that conversation, and I'd be more than happy to help you get that set up.
Yeah, the developers of the films really have a lot of information in trying to assist communities, individuals, to keep it moving forward. So they help with dialogue guides, as well as how to get the films, and as Shannon said, a lot of discounts depending upon your status and education, nonprofit, etc.
Okay. So get your pens out and your pieces of paper and write this down. So Roger, where should somebody go to your website? How do they get to you to find resilience or whatever?
Okay. So our website is www.idahochildrenstrustfund.org.
Okay. Shannon?
.org.
We are www.thespeedyfoundation.org and /resilience.
So Idaho.com. Optum OptumIdaho.com.
Okay. And we're the Idaho Federation .org. So you can go to any of these places to be able to hopefully find out about how to access the film or show the film and what you want to do. Shannon, James Redford is Robert Redford's son,
Yes.
and you know Robert Redford or James Redford?
We've got family connections, yeah.
Okay.
My aunt is James's aunt as well.
Okay.
Yeah.
So
We're not cousins.
So is there an inside story here in terms of why did Paper Tigers and Resilience appeal to James Redford? Do you have any idea? Why did they do that?
His wife, her name is Kyle. She is an educator in Marin County. She's also an author, and she writes often for Huffington Post on education and other education forums. They have a son who was dyslexic, and I believe that the whole idea of ACEs came about as he was doing a documentary on learning disabilities and dyslexia with his son. I believe that's how the topic came up, and the project has proceeded.
And went from there.
Mm-hmm.
Yeah, that's pretty cool. And he's going to be with the principal of the school, whose name I can't remember at the
Jim
moment.
Sporleader.
Jim Sporleader?
Yeah.
Okay. And they're going to be facilitating the workshops on the 13th in the afternoon here in Boise. And I'm just wondering, one of the things that is part of the program in the afternoon is call to action. What are we talking about there? Let's have that. We'll just open that up to talk about it. But call to action. What is that going to be like at the workshop? And what are we really talking about? What kind of action do you take? Anybody?
Well, the way the program has been developed is the call to action component is really a brainstorming session among folks, at individual tables, talking amongst themselves after they've heard the presentations, after they've viewed the screening of the film, and really trying to take it down to the most basic level. Okay, what can we do today, tomorrow, the next week, the next month, the next year, within our control and working together. So it's really, it starts with a dialogue and this brainstorming session that will have a really fun, interactive tool to assist with and to really get the audience engaged so they can walk away with something like, yep, I can make a difference.
Anybody want to add to that? Okay.
Yeah, tangible changes that we can take and make in our communities. Absolutely. How do you go from that buzzword resilience to action?
And we like to talk a lot about the idea of, small but significant changes, so you think about, okay, they're just things we can do that are affirmative rather than putting somebody down, making your kid feel like, there's something wrong with them. As Shannon mentioned before, we talk a lot about, well, what's happened to you rather than, what's wrong with you, so that you start to recognize that, it's those children's experiences, not their something that's wrong with them, fundamentally or something, but that we need to learn as adults, and it really is adult work, adults need to learn how to respond to kids, and how to create the environments where kids grow up without those adverse experiences, so that we talk about resiliency. How do we build resiliency, and how do we keep, making that the goal rather than the goal. Or I don't know. I shouldn't say that. I'll stop there. I was going somewhere and it didn't make sense.
Okay.
Yeah, it
Even to
really, I think, in planning it and talking about it, if each individual who attends the day's session can walk away with something that they themselves can do to make positive change, that is a success. Of course, then growing it from there, like I said, as communities and working together across disciplines, will just continue it moving forward.
And this is really where it starts, is people learning about it. It's inspiring people to think in different ways. And again, I was saying we had done some trainings on this, and we've been doing trainings around the state on these issues for a while on both ACEs and protective factors, and getting people to think more about, okay, so what's the action within my own discipline, within my own work, within my own parenting, that I could do that would make a difference for the children in my life.
Okay, so tell me about parenting, the part, because I don't know if I'm confused or anybody else out there might be confused as well, but so we're talking about ACEs, and that we sort of said be an adult to take the ACEs test.
Right.
And how are we going to find out about the trauma in kids' life if adults are taking the test? I mean,
So I would say that what we're suggesting is that there are adverse childhood experiences, and I think Roger said that they're common. They're common. Sometimes they are not talked about. Sometimes these things have happened to you and you've never addressed them in your own life. And somehow you've gotten through life. You've had other resilient strategies that have gotten you to this point, and maybe now you're a parent raising a family. And you first need to look within yourself and recognize, were there any adverse childhood experiences that occurred? Know that they are common, know that there's something that's gotten you through to the point where you're at, and that this is happening to a lot of other people. It's not just you. Once we understand what the cycle is, we can start breaking that cycle, and so that you can start addressing any adverse childhood experiences that your children face, and find resilient strategies that you can teach them so that they can become resilient members of the community. And hopefully, when they're ready to become parents, their children are not going to have to face those adverse childhood experiences. Mm-hmm. So it's kind of this giant circle of life where we're trying to find a way to break that cycle.
Exactly. And so, the term that comes into my mind is trauma-informed care. Mm-hmm. Does that fit into the film, to resilience? Is that how does that work? Anyone want to take that? Rod?
Go ahead.
I'll start. You can fill in. Yeah, I think what Dr. Anda, who's one of the researchers in this, says what's predictable is preventable, and I really like that because it gets us to start thinking about trauma-informed programming or services or care, because what it does for us is it says, all right, so if we know that these things are in existence, then what can we, then how do we change the way in which we respond so that those kids are not re-traumatized by our, you're going to detention, we're throwing you in the clink or sending you to the principal's office or whatever. But we're gonna start recognizing that, okay, so you've been through some stuff. So how do we respond to that in a way that actually moves them forward? I mean, I think we want all kids to succeed, and I think everybody wants all kids to succeed. And this just gives us another tool in the toolbox to actually help kids succeed, to do well by dealing with their both emotional trauma and with their academic and other kinds of learning things. And trauma-informed care is I think, as you said earlier, a paradigm shift in the way that we respond. And we say, okay, there's no throwaway kids. There's kids that have had issues, and we've got to help them go forward and succeed.
So in Paper Tigers, that was sort of more or less the theme of what was taking place in the school. And so when the kids are in the school, why do you guys know? Why did that school decide to take that other route with their kids? Because their kids had a lot of disciplinary problems and mental health problems.
Yeah, so it was an alternative school. Lincoln High is an alternative school in Walla Walla, Washington, and the principal at the time, who's now retired, Jim, attended a trauma-informed workshop, and so he came back to the school, and as an educator, usually you're given curriculum and you implement the curriculum and you take data and you determine if there are positive outcomes. But there is no curriculum for implementing ACEs. ACEs is a mind shift as far as how you're interacting with your students and what discipline looks like. And so he revolutionized the way the school disciplined their students. Working in alternative schools, you're going to be working with students who have all kinds of trauma going on in their lives, mental illness, drugs, abuse, neglect, lack of motivation. There's all kinds of things that take place in typical school, but it's compounded in an alternative setting. And so that's how my understanding of Jim's approach came to be. But you'll have to come next Saturday and hear from him yourself.
Exactly.
Yeah.
You can ask him that
Yeah.
directly, though.
Yeah, good question for Jim.
Yeah, because I thought that was curious in that, are there schools all over the country doing this now?
More and more. I know that the Boise School District is looking at community approach, where they will be bringing in other community supports to that school site and give wraparound service. I believe this year in Meridian, it was the first school in the state to have a clinic. I believe maybe Meridian Middle School or Meridian High School, having a clinic on site to get some of those health needs met for students.
That kind of thing. Well,
I
yeah.
just recently got a call from somebody in Rupert who's interested in doing training around trauma-informed and learning more about ACEs, and that had come out of another presentation that we did, but they want to spend a whole day, maybe look at one of these films and talk about it within the teachers. So they're I'm excited by how much interest there is. I mean, this has been out there for a while, but I think these films have really elevated it, and a lot of people who hadn't, just popularized it in a way that people hadn't heard about before. It was kind of tightly within, a certain field, rather than being part of the common conversation. And I think we're starting to hear it more, at least within, a larger group of, frankly, educators, other folks who, have a lot of impact and relationship with kids. So I'm very excited about it.
So are we only talking about it being? Is it just a school thing? I mean, I guess what I'm thinking about is like. No. Okay, that's all right.
No.
All right. So
I know, we
tell
keep
me,
making it sound like
what's
one
what
thing.
Yeah.
So people are listening to us say something about ACEs, what it is, and so. Does it just happen in school? I mean, how do you make something happen with this? If you're out there listening, say, do I call Georgianne? Do I call Optum? Do I ask the trust fund? Do I call Speedy? I mean, how do I actually get all this to take place? Can you explain that?
First, come to the table and let's have a conversation about it. Come next Saturday. It's not just educators, but that's one way where we can access, young people and start changing lives. It's the front line is the doctor's office, your primary care physician, getting primary care physicians to start taking a trauma-informed approach towards practicing medicine. So in the film Resilience, you'll meet Dr. Burke Harris, who changed her practice and started seeing incredible results that she wasn't seeing anyplace else, just by asking questions and taking kind of a group approach towards that practice. Law enforcement is another place where we can really change the tide. Corrections is a place where if we are asking not what's wrong with you, but what happened to you, if we can take people that are in the corrections process and address the needs that weren't addressed in their childhood, teach them the resiliency components of positive psychology, give them those supports, we could be preventing crime and transforming lives.
Yeah, absolutely. And that's why, I spoke about it earlier, the professional development classes, if you will, that will be a part of the resilience screening on next Saturday is, it's interdisciplinaries. It's not just, corrections needs to do this, law enforcement needs to do this, educators need to do this. They all have to be working together in order to make change.
Mm-hmm. So that's like a sort of what's the wraparound kind of idea?
Yeah.
That's pretty much talked about in our fields all the time.
I think the success of kids is, we really are all in this together. And the more that we recognize that and see how we, that our different disciplines, places we work, whatever, shouldn't define what it is that we do to make sure that children do well. We should be in this together in a way that realizes that all of these are the parts of the same. I wanted to add parents to the list of people. I mean, and of course, most of those people in all those professions are also parents, but also people who maybe don't see themselves in any of those places, because how we as parents relate to our kids is really probably as somebody said earlier, the most important thing is a caring adult, and that really is for all people. What is going to have the most impact on helping them move forward is to have one or more caring adults. The more caring adults, the better. But at least one good one.
One good one. Okay, that makes sense. I just want to remind people that you can do this chat box if you're watching it through your computer. And we'll take some questions if you have anything that you want to ask anybody on of this group. My last kinds of things I think about the film itself, and I know that in Paper Tigers, I keep getting caught up in the Paper Tigers. Would you call that an application of, because did they do the ACEs test on all the kids in Paper Tigers, and so is it an application of results to what they did in the school? You know what I'm saying? Is that something?
Yeah, I mean, it's following the children in their school and their lives and talking about what happened to them, and then what the changes of behavior that the school administrators are doing in order to help those children.
Hmm.
So Steve, I think in Paper Tigers there is a scene in a science classroom where a teacher is using technology, having the students take the ACEs test for themselves. And the test results are shown on a whiteboard through the projector, not with people identified, but just to show the class in this room, here are the adverse experiences that people have experienced. And you can see which ones are high, which ones are low, where do you rank? And these students are sitting back going, wow, like I didn't have any adverse childhood experiences, but all of these other people did. Or I had a lot and other people had a lot as well. I'm not alone. And the teacher frames it in such a way where it's not poor you, or there's nothing negative about it. It's just, this has happened. How much of this happened to your parents, and how are we going to be different than our parents? What can we do to change our own lives? And then building an understanding of how the brain works. In this scene in Paper Tigers, the teacher also goes into just the science behind the brain, how we learn, and how if our brains are completely fried and wired based off of the trauma that's going on in our lives, there's no way that we can be learning academically. So it kind of just sets the stage for, if we're going to be successful in school, if we're going to be successful in life, we need to get some stuff taken care of, and we need to have some positive strategies for living life.
Yeah, and to build on that, in that scene, one of the most revealing things to me was some of the kids that they were profiling. I think just awareness for themselves that, maybe they knew it, but they didn't know it until they took that ACE assessment, and they're like, oh, yes, this, and this happened. Well, no wonder, I'm feeling the way I'm feeling about some things.
Yeah.
But we also say that, since the ACE study was done with 18,000 people, and it's been done with lots more since, it's large enough where, as anybody who's working with families, or, like you're teaching Sunday school, or you're involved in whatever it is, coaching a team, you can expect that some group of people are going to have had that, are going to have some of those experiences. So whether you take it or not, you can, if you start to recognize that it's likely to be common, it's likely to be in the group that you're working with, that people will have had experiences, and that they're and that you can help them build resiliency. That you can operate, like we say. Well, what would be the harm of everybody being treated, as if it were all trauma informed, right? Nobody's the worse for a little more nurture, a little more caring, a little more love. It's
just approaching life with empathy. We talked about educators and law enforcement and corrections and medicine, but it's anyone. It's bus drivers. It's working, a front desk. It's treating every person that you approach with empathy, and thinking to yourself, where is this person coming from? What have they experienced for the behaviors that they display?
And so we're talking about this through, this is, as we said in the beginning of the program, this is Children's Mental Health Awareness Week and today. And so in kids' mental health, how do we make this application of trying to discover what's taking place in their lives, and then try to, how quickly can you make that change in a school? Because you only have kids for a certain amount of time. So how could that happen so rapidly? Anybody?
Sure. So as Jim Spurlander found out with Paper Tigers, there's no curriculum to implement. It's got to be kind of this paradigm shift in education. From the Speedy Foundation's perspective, we would suggest starting with training. You could set up a youth mental health first aid training in your school to learn more about mental health. Mental health first aid goes into depression, anxiety, psychosis, substance use and abuse, eating disorders. And at the very end of the training is a gatekeeper for suicide prevention. It's a curriculum that's put on by the National Council for Behavioral Health. It is research-based, and it goes into protective factors and risk factors. It's very complementary to the conversation that we are having with Paper Tigers and with the film Resilience.
Yeah, for Optum Idaho, it's not about a timeline of how quickly you can make change. It's a fundamental shift in just how you act, what you do, how you treat people, and how you provide care to those individuals. So it's not about, for us, it's not about a timeline. Again, I go back to, it's about education and information and having conversations to make the shift that's sustainable and for the long haul.
Here we are you're talking about this. Obviously, we're all in favor of this resilience. We liked Paper Tigers. We're in favor of that. So ACEs, adverse. It seems to me that there's been some adverse response to ACEs as doing what it claims to be able to do by other professionals. Is that anything that you've experienced or hear about?
I'm not sure exactly what you're talking about, but in terms of, I know that one of the things is we don't want to focus only on ACEs, because that's why we focus on resilience, because when we focus on ACEs, it feels like it's your destiny, it's fatalistic, But again, it's with that idea that what is predictable is preventable. We want to change the trajectory. And so, we don't, so to the extent that we can get rid of, or I shouldn't even say that, because people will experience traumatic experiences, but how do we help them to be able to deal with that and to grow from that? Because there are going to be adverse experiences in your life. There are going to be traumas in your life. How do we respond to that in a way that moves you forward rather than, keeps you mired in those problems? And so I think if you just get stuck in the ACEs, if you just get stuck in talking about adverse childhood experiences, and that's all you talk about, it weighs you down and it's heavy. But when you realize that that's just a tool for helping you understand how to build resiliency, how to do the things that we talk about, building healthy social connections, moving forward in those ways, other kinds of things that build protective factors. And the ACEs just give you the foundation to start talking about what you can do to make kids' lives,
absolutely.
Successful.
And for us, it's really about building a system, an integrated system that is about resilience and is strengths based. So what do you do well, and how can we continue that? So really, being positive because everybody has strengths. No matter what has happened to you, everybody has strengths. So being able to build on those in order to move forward.
Okay. So, because in the strengthening families thing, it all seems tied together to me.
Yeah.
And but I'm fortunate enough to know you folks and what it is that we're talking about in terms of that stuff.
Yeah.
But I don't know if the people in the audience actually might recognize that what we're really saying is ACEs is not going to, it'll be surprising to you perhaps if you take it because you're asking questions that you don't necessarily ask yourself.
It could be, yeah.
And so would people be afraid to take this test? Or not?
If you're afraid to really do some self-reflection and examine your past, it could be frightening. And so definitely prepare yourself. But there are 10 questions to reflect upon and realize that you're still standing here. And so something has gone right. Let's figure out what's gone right. And that's why, we have the ACE test listed first and the resilience test second. So definitely don't stop after discovering your ACE score. And I think that's another thing to consider when implementing, an ACE score with young people or in any kind of profession, that it doesn't just stop with taking the test, that there's this whole positive side of what's going well. Sometimes in life something happens and we don't ever name it, we don't ever address it, and it becomes baggage. And so for many people who have high ACE scores, they've got a lot of baggage, and if we can address it and name it, we can work on getting past it.
Okay. Well, I don't see any particular questions coming up, and I know that we're going to be through our program in about 5 minutes. So I want to just give each of you the opportunity right now to talk. What do you feel about the film itself? In a way, why are we doing this show? Or why are we doing this program? Why are we talking about this? And what does it mean to you in Speedy? And I'll start, Shannon. I just want your, wrap up kind of ideas here.
Sure. So for the Speedy Foundation, we found that Paper Tigers and Resilience are both powerful, powerful films. And we really felt the call to action based off of Speedy's life and how he used his platform as an Olympic aerial skier to speak in the media about some of the trauma that he experienced in his life. He didn't have a perfect life. He didn't have a clean life. And his ACE score is quite high. His life ended in the result of suicide, which in looking at the ACEs study, the more ACEs that you have, the higher your risk of suicide is. And so clearly there were interventions that could have taken place, and there were resiliency factors that Speedy needed to build. So in our mission to hold conversations about mental health and suicide prevention, this seemed like an incredible platform. For me, myself, I'm compelled to this topic because I spent 10 years in the public school and taught in an alternative school where these conversations were not taking place, and children's lives are impacted when there's silence. And so that's what compels me to spend my time and help try to further this conversation.
You have spent a lot of time, and you really are helping to further the conversation. Roger, what do you think?
Well, I think the film, makes it possible for a lot of people to hear something that otherwise, might be stuck in, the world of doctors and medical folks and and people in the professions, and makes it possible for a lot more people to know it. Because again, I think the real thing is that we're all in it together. I mean, we're this work can go on at the YMCA, it can go on at the Boys and Girls Club, it can go on at home, it can go on in our neighborhoods, in our churches, and our schools, and at various other places. And the film, I think, makes it possible for us to really have that conversation in a broad way with more people, with people who maybe are otherwise not exposed to it.
Well, we started with Georgianne. We'll kind of come to almost the conclusion with Georgianne. What do you think?
Yeah, so, Optum's In Touch community conversations are all about building awareness and education and bringing more information to the people of our communities. And, this film, Resilience, is really about a conversation starter and having that dialogue in order to take action and, continue to, build awareness that, childhood trauma has profound effects on our children. And as Roger said earlier, we want every child to succeed. So, the old cliche saying, children are our future, absolutely. So what are we doing as community members to ensure that they're succeeding? And so, again, we're just so excited to have these great partners and bringing these films to our communities, to just continue to build on the conversation and take action.
Okay. And we're all happy to partner with you as well. I just kind of do this one more time.
Yeah.
If they want to register to go to the Boise program or the other programs, what do they do?
All of the screenings you can register for at www.thespeedyfoundation.org/resilience. registration is free. There are refreshments. Our conference is free.
Can people can just find out about resilience by going to resilience.com or something like that?
If you go to KPJR Films, you can find out more about both films. You can Google search, resilience and ACEs scores, and it'll take you all over. There's an organization called ACEs Too High that you can follow. There's a lot of resources out there.
Okay. Well, we're about coming to the conclusion of our program, so I want to thank Shannon Decker, Roger Sherman, Georgianne Benjamin for being with us today at the Federation. I want to wish you all a happy Children's Mental Health Awareness Week and Day, and want to say keep the ball rolling for children's mental health, and see you the next time in the next program.